Uterine cancer is the most common gynecological cancer in Australia, with more than 2,000 women diagnosed each year. We will guide you through the cancer's risk factors, symptoms, the process of investigation and diagnosis, and what treatment options are available to you.
Uterine cancer is a malignancy that's arising from the inner lining of the womb. It's incredibly common. We almost diagnose about 2,000 Australian women per year, and its incidence is still rising, it's going up. Most of those uterine cancers though have a very good prognosis. Only about 20% of uterine cancers are very aggressive cancers.
There are certain risk factors leading to uterine cancer. Obesity, diabetes mellitus and high cholesterol can cause an oversupply of estrogen in the blood, resulting in an overgrowth of the endometrial lining. Another risk factor is hereditary development, where the patient has inherited genes from their mother or father. If the patient has had a history of breast cancer and has received treatments for the disease, this is also considered a high risk factor in developing uterine cancer. Most women who are diagnosed with this type of cancer are menopausal and aged 50 years or over. A common symptom of uterine cancer, which occurs in 90% of cases, is abnormal bleeding. This is where the patient will experience a blood-streaked flow or even just spotting. After menopause, any vaginal bleeding or spotting is abnormal. If bleeding or spotting occurs, women will need to see a specialist. In the case of abnormal vaginal bleeding, women will need a gynecological exam of their pelvis and an ultrasound. If the thickness of the inner lining of the uterus is more than 3 millimeters, then a biopsy is required. A biopsy can be performed under general anaesthetic or awake in the surgery. However, this is not often possible for women who have never given birth or elderly women. The biopsy will allow Professor Obermeyer to confirm or exclude the diagnosis of cancer by examining the tissue scrapings. If cancer is diagnosed, the next step is determining the stage of the tumour, which identifies if the cancer has spread elsewhere. To examine this, the patient will require a CT scan and blood tests. While undergoing a CT scan, a series of X-ray pictures will be taken of the patient's pelvis, abdomen and chest. An injection may be needed so that lymph nodes and other tissues can be seen in the pictures. In some centres, they may perform an MRI scan, but don't be alarmed, this scan produces very similar results to that of a CT scan. There is no way to examine a tumour or determine its age, so it's different for every individual situation. However, it generally takes at least a year to 2 years before a tumour can be seen with the naked eye, but at this point the patient usually hasn't experienced any symptoms. Type 1 uterine cancer grows at a slow rate, and type 2 tumours grow at a much faster rate.
Endometrial cancer is a very common disease, and most of these cancers arise from the inner lining of the uterus or the womb. Now, this is a cross-section of a female pelvis where we have the bladder at the front and the rectum at the back, and the uterus is actually embedded in the middle of that. Now, most cancers present with a period of abnormal bleeding, and that can indicate cancer, and that bleeding comes actually from this inner layer of the uterus.
When treating uterine cancer, surgery is a key element in the process. Recent studies suggest that laparoscopic or keyhole surgery is far more superior in delivering great results than open surgery. During the procedure, the uterus, cervix, tubes and ovaries will be removed, and often lymph nodes need to be biopsied. These lymph nodes drain lymphatic fluid from the legs and pelvis and may contain cancer cells. Only a few lymph nodes are taken. However, if the cancer is considered an aggressive type, then more will be removed.
Significant advances have been made in the treatment of uterine cancer, especially when it comes to less invasive treatment methods, where women do not stay in hospital 5 or 6 days anymore, but go home after 2 days, and where the risk of adverse events or surgical complications is a lot less. So that's a very, very good development.
A vast majority of patients do not need any further treatment after surgery, but will need to be seen for regular follow-up consultations. However, women with aggressive features of the cancer or patients in whom the cancer is spread will be recommended radiation treatment or chemotherapy. Radiation treatment is very effective in minimising the risk of recurrence, as women who are diagnosed with aggressive cancer types can often experience recurrence in the vagina or pelvis. Chemotherapy is also very effective, but targets the whole body and not just the pelvis. In rare circumstances, a combination of radiotherapy and chemotherapy will be recommended.
Look, the surgery went really well. Within probably about 6 weeks, 7 weeks, I was feeling really on top of the world, and my life has been really good. I've got a very, high functioning job, and I'm still working, and I enjoy my work, and so everything's really, really good. Yeah, really enjoy life. Life's wonderful. Yeah, so that's good.
Once all treatment is completed, follow-up consultations with Professor Obermeyer will be required every 3 to 6 months for 5 years. On each visit, a vaginal pelvic examination will be done to ascertain the patient's health and to ensure they are disease-free. Blood tests or CT scans may also be arranged at these consultations for further reassurance the patient is still healthy.